Hi, I'm Dr. Barrion with IQ Laser Vision. Today we're going to answer some frequently asked questions about the EVO ICL. The EVO ICL is a micro-thin synthetic lens that is implanted in the eye behind the iris, or the colored part of the eye. It corrects moderate to high levels of nearsightedness or myopia with or without astigmatism. The ICL is smaller than a contact lens, but very much like a contact. It's soft and pliable and biocompatible. EVO ICL does not need to be removed once it's implanted. There's no maintenance. It doesn't require exchange. The first ICL was actually approved in 1993 and brought here to the United States in 2005. The most recent generation, latest generation ICL, called the EVO ICL, has been used internationally for the last 10 years and approved here by the FDA in 2022. Since then, over 2.5 million EVO ICLs have been implanted worldwide. No, you will not be able to feel the EVO ICL once it's been placed inside the eye. It remains completely hidden from your senses, and it does not cause any discomfort or weariness. No, the EVO ICL is implanted behind the iris, which is invisible to you and to others. In fact, only your eye care provider would be able to see that you've had any vision correction done. In most cases, we perform surgery on both eyes on the same day. However, in some cases, we may need to measure the fit of the first eye to guide us on the second eye, especially if there's a difference in the size of the lenses required. In rare cases, less than 1% of the time, we may need to replace the ICL of the first eye with a different size. IQ Laser Vision utilizes robotic ultrasound technology to produce high-resolution images of the eye structure. This technology allows our surgeons to determine the precise size and the placement of the lens. Based on your exam today, you're not a good candidate for laser vision correction, which includes LASIK, SMILE, or PRK, because either your prescription's too high, your eyes are too dry, or your corneas are too thin or not structurally strong enough. Proceeding with laser treatment in such cases could result in poor outcomes and serious complications. The EVO ICL is designed to safely and effectively treat moderate to severe nearsightedness and is ideal for patients who are not qualified for laser vision correction. We've been performing ICL surgery since 2010. Our founder, Dr. Robert Lin, is the most experienced EVO ICL surgeon in the United States and leads our ICL surgeon team, comprised of Dr. Patrick Pham, Dr. Erica Liu, and myself, Dr. Amy Barrion. Collectively, we have over 30 years of ICL experience and have performed thousands of ICL procedures. The ICL procedure takes about 15 minutes per eye. While lying on your back comfortably, we'll numb your eye with drops, after which the eye will be held open with a small eyelid holder so you don't have to worry about blinking. You look up straight ahead into a microscope light, and you'll occasionally feel light pressure on the eye, but otherwise it's very well tolerated. We offer patients a sedative before surgery. This, combined with the numbing drops for the eye and the quickness of the procedure, makes the ICL procedure very easy on the patient. Patients experience very little discomfort during and after the surgery. Like laser vision correction, you will see better immediately following the procedure. A clear plastic shield will be taped over your eyes to prevent accidental rubbing. You may experience some light sensitivity for a few hours due to the dilation of the eye. Mild discomfort and burning and tearing are very normal and typically subside within a few hours. After surgery, we recommend that you wait at least 24 hours before driving. Once you feel visually safe, it's okay to drive. You can do near tasks like using a computer or reading the day after surgery. For activity restrictions, we recommend that you don't rub or hit the eye, no contact sports, no water activities like swimming or hot tubs, and no lifting heavy weights for at least 2 weeks after the surgery. There's also a number of post-op visits that you have to attend during the first year after surgery. The EVO ICL is a highly accurate procedure and can provide patients with vision comparable to or even better than what they had in their glasses or contact lenses. For most patients, this does result in 20/20 vision, but there's a small chance that some residual prescription can remain, which could affect the maximum clarity of vision. In such cases, a laser vision correction enhancement can be done a few months later to fine-tune the results. The ICL has undergone rigorous FDA clinical trials over 2 decades to prove its safety and efficacy. So, provided you're a good candidate, it would be rare to experience serious complications, and also rare that such complications could not be successfully resolved. Thus, the chance a patient may experience permanent vision impairment is remote. Keep in mind, though, that there are also risks of serious complications related to wearing a standard contact lens, including corneal infection, that can result in permanent vision loss. Fortunately, the EVO ICL design has a remarkable track record. 0 cataract formation has been reported over the last 10 years. However, despite this, some patients still develop cataracts after the procedure months or years later. If you do develop cataracts, rest assured cataract surgery is highly effective. The surgery involves removing the ICL and then removing the natural cloudy lens and replacing it with an artificial lens or IOL. After cataract surgery, your vision can be restored, allowing you to see clearly again without the need for glasses or contact lenses. Your patient counselor will guide you through the process of scheduling your ICL procedure. They will inform you of the available dates and discuss cost of treatment. They will provide information on how to use your pre-tax medical reimbursement accounts for payment. In case you require financial assistance, they will explain the interest-free payment plans available to you if you plan to finance your payments. Prior to your surgery date, you'll attend a preoperative appointment for detailed prescription testing, eye biometric measurements, and a dilated retinal exam.